Hello, everyone. Welcome to this presentation on trauma and wellness. My name is Andrea Kendall. I'm an LCSW, and I work primarily over in outpatient behavioral services for Augusta Health. So we'll get started by talking about sort of how we define trauma. And originally, trauma was used in a medical term. You can see some definitions of medical trauma: physical injuries of sudden onset and severity, which require immediate medical attention, and kind of hold that immediate attention sort of in the back of your head. And injuries such as a wound to living tissue caused by an extrinsic agent. So when we talk about psychological trauma, obviously we're talking about the same severity, but in a different way. And the Augusta Psychological Association defined psychological trauma as an experience that causes severe anxiety or emotional distress, such as rape or combat. As part of the Diagnostic and Statistical Manual, which is sort of what we in the mental health field use, the definition of trauma includes an experience that involves actual or threatened death, serious injury, or sexual violence to self or loved one. I also added witnessing such an experience. Obviously, it's much more traumatic to witness it with a loved one, but certainly witnessing a serious traumatic accident, even if you are simply a bystander and don't know the person involved, can be quite traumatic. So when did we start talking about trauma as a psychological illness and not just medical? Jean-Martin Charcot, I believe is how you say his name. He is considered the father of modern neurology. And in the late 1800s, he was treating women with a cluster of emotional symptoms labeled as hysteria. And that is a belief that had been around in some way since 1900 BC, this idea that there were unique vulnerabilities to the female sex that caused all manner of emotional symptoms. And he argued and sought to prove that the cause of such symptoms was actually underlying trauma. And he found that this was not exclusive to women, could be found in railway workers, combat veterans, other people who had been in severely traumatic situations where there had been physical injury or fear of injury or death. And so he really paved the way for this understanding that something like an industrial accident, a war-related event, those kinds of things, in addition to abuse and sexual abuse, could cause what we consider psychological trauma. So he was on the right track. However, along came Sigmund Freud, who we all know well as the father of modern psychology, who really sort of carried the day at the time, and he did not agree with Dr. Charcot, and he felt like hysteria was exclusively female. He did think it was trauma-related, but thought it was solely connected to sexual abuse. And so that really sort of took precedence. And so this idea that psychological trauma, A, could be universal, and B, could happen to people from all kinds of events, not just sexual abuse, was really derailed, and it didn't reemerge again until World War I, when the term shell shock was coined, and it evolved from there. That is also an interesting sort of route to follow through history, but that's another presentation for another time. So what causes what we think of as psychological trauma? Well, there's some big ones. Certainly abuse, physical, sexual, or emotional abuse in childhood or in adulthood. And sometimes abuse has sort of a broader definition than we think of, and most folks know about the first two, but I've certainly worked with many clients over the years that say, no, I did not have an abusive childhood, I was not mistreated, but then they will share with me some of the things that adults said to them who were in charge that were threatening or shaming or frightening, and that does indeed constitute a form of abuse that can leave lasting effects and cause trauma. Another common source is neglect, either physical or emotional, so not having one's basic needs met, food, shelter, clothing, safety, being left alone for long periods of time when one is entirely too young, or being left with an unsafe adult. A lot of clients I work with who grew up in houses where there was a lot of addiction report being left alone way too young, or left alone with strangers who were sometimes scary and harmful. And there can also be emotional neglect where sort of the basic needs were met, but there was no care or nurturing or reassurance, and that can cause trauma. Some other sources. As it said in the definition earlier, threat of death or severe harm to a self or loved one. So that includes domestic violence, either experiencing it or witnessing it. I've definitely worked with folks over the years who were not the direct victim, but watched one parent harm, threaten to kill the other parent. Very traumatic. Environmental violence. So this has to do with sort of living and existing in an environment that is chronically frightening and threatening. And I wanted to read a quote. When you are constantly exposed to violence or constantly under threat, or you feel as though you're constantly under threat, the parts of the brain that are involved in learning get shut off. And what happens is the surviving brain takes over. And so they're constantly in survival mode. That means the future is irrelevant, and in some ways, the past is irrelevant, except as the looming threat. All that matters is, quote, what do I need to do now to survive? It's any place that there's ongoing conflict, and that's how people have to live. And this was a quote from Dr. Bradley Solbach, who is a clinical psychologist and a director of a program called Healing Hurt People. And he is not referring to a war zone or anything like that. He's actually referring to an extremely violent neighborhood in Chicago that he created this program to help, because these children were living as though they were in a war zone. And so when we say environmental violence, we need to really broaden our understanding to include neighborhoods where things are chronically frightening and unsafe for all number of reasons. Another source of trauma is repeated threats and discrimination toward marginalized people. So knowing that anytime that you leave your house, you might be targeted for the color of your skin or your beliefs or your gender, all of those can cause long-term trauma. So what happens? Well, unfortunately, childhood trauma causes permanent changes in the brain. There is something called the limbic hypothalamic pituitary adrenocortical axis, or LMPHA, and that's a very fancy way of describing the very complex system in our brains that regulates cortisol, also known as the stress hormone. And with chronic trauma exposure, it becomes permanently dysregulated in a lot of different ways. And so one of the main things that happen is what we call priming. So when you hear people talk about hypervigilance, that's what they're talking about, that their brain is already primed to expect danger, to experience things as danger, and to respond accordingly. So the way that works, for example, is if I'm a young child and I have grown up in a scary, traumatic environment where the adults have not kept me safe, when I go to school, if a teacher raises their voice in the classroom, the other kids might stop, listen, be briefly startled, and keep going. But I will have all of these reactions in my brain that I am in extreme danger, that I need to find safety, that I need to figure out what to do right away. And so it will take me a very long time to calm down. The parts of my brain that sort of help me figure out that I am not in danger don't work as well. And so it's something that is really important to think about in all settings, but especially, things like school, where things that maybe we, sort of as the average untraumatized person, don't see as frightening or dysregulating may be very, very upsetting to folks who've been traumatized. Another thing that childhood trauma does is disrupt your serotonin, and most folks know serotonin is the feel-good chemical, and it is a critical element of the stress response system. It plays known roles in regulating your emotions, cognitive function, motor function, appetite, and lots of other physiological processes. And disruptions in serotonin, which trauma can cause, we don't know why, but we know that it does. They're linked to many of the disorders that are commonly seen in children and adults with trauma. And they are associated with depression and anxiety, aggressive behaviors, and personality disorders such as borderline personality disorder. Oxytocin, another brain chemical that becomes permanently dysregulated. People sort of know oxytocin is the cuddle hormone, but it is responsible for a wide range of social interactions, including social memory, cognition, emotion recognition, empathy, and attachment. And when it gets disrupted in both directions. So for some people who've been severely traumatized, the ability to make connections and attach to other people, they find it extremely hard. And for some, it goes in the other direction. Young kids who've been severely abused and neglected often have what we call indiscriminate attachment. Well, they will be as open and get as quickly attached to strangers as they would, say, a grandparent. When I was a social worker at an inpatient psych hospital, I had a lot of kids who would meet me and right away, within hours, tell me they love me and ask me to be their mother. And that's that indiscriminate attachment and that oxytocin that just kind of goes haywire and is producing things that are more appropriate for, say, a mother-child relationship. It also affects neuropsychological functioning and cognitive development. A lot of studies examining trauma in childhood show that children demonstrate lower IQs. They have deficits in language and academic achievement. There are literal structures of the brain that are altered. They are often smaller or more poorly myelinated, and myelin is sort of the insulation that goes around sort of the places in our brain that conduct signals. It interferes with what sort of we call executive functioning, which is the type of decision-making and problem-solving and processing that's required in sort of higher-order decision-makings. For example, this car backfired. It's not a gun. I'm safe. Those processes don't work as well in somebody who's been exposed to chronic trauma. And all kinds of things become affected by these control circuits, including their ability to regulate their sense of self, their motivations, their behaviors, impulse control, all of those kinds of things. So what we're really talking about here that gets disrupted is the ability to self-regulate. Self-regulation refers to the ability to manage your emotions and behavior in accordance with the demands of the situation. And it is learned from our caregivers in our environment. So from the very first moment that we are crying as infants and somebody scoops us up and soothes us, comforts us, feeds us, changes us, we are learning self-regulation. And we do not learn unless it is first given to us or presented to us. Because in order to sort of develop our own self-regulation skills, we need to feel like the world is a safe place, everything is okay, I am okay. So what happens, when those things don't happen, we don't develop those self-regulation skills, or we do it, but we don't do it well, and we do it sort of in an erratic kind of disruptive way, or we do it in sort of maladaptive ways that work really well in the moment, but don't work so well long-term. For example, people who come from abusive and neglectful environments often really struggle when they cannot get their needs met, and they will do what has always worked for them in the moment, which is to act out and demand an immediate response. And that works well in the short term. You do get a response, but it does not work so well in the long term in that you get in trouble. You might get arrested. You might get evicted, those kinds of things. Trauma makes self-regulation much harder. There's that priming again, all of those brain processes involved. So here's sort of a photo on the left of a student getting feedback from a teacher. And for a traumatized child, that may feel more like the photo on the right, where they feel like they are being threatened, screamed at, berated, because that priming has already happened. And in their past, an adult coming to them with corrective feedback is a dangerous and scary thing. So imagine being a traumatized childhood and being in a classroom. And anytime an adult comes toward you, you have this reaction on the right. Pretty difficult to get through the day. And same thing for adults. I have this example where on the left, someone is getting feedback from a supervisor or a coworker, and on the right, it is this screaming, angry, kind of scary thing. So someone, an adult, may experience, constructive feedback from a coworker, from a supervisor, as something very frightening, feel very attacked, and there may be a lot of what we call miscuing that goes on in response, whereas the person is actually saying, well, I'm not yelling at you, everything's fine, but the person who's experiencing it cannot calm themselves, cannot self-regulate and feel okay in that situation. And there's lots of examples. Certainly, very close connections between trauma and mental illness. The more common ones that we know about are depression and anxiety, of course, very strong links between trauma and those issues. PTSD, or post-traumatic stress disorder, is the long term, is sort of the clinical description of someone who has a collection of symptoms caused by trauma, including hypervigilance, a sense of foreshortened future, like they're not going to live very long, flashbacks, re-experiencing nightmares, those kinds of things. And a newer term that you're hearing more is something called complex PTSD, and that refers to multiple traumas over time. So one trauma is layered on top of another that makes all of these symptoms much worse. One of the things that occurs with trauma is there are very strong links between trauma and addiction. So these are some things that I've pulled up from some different research studies. 59% of young people with PTSD develop substance abuse problems. 55 to 60% of addicts have childhood trauma. I have heard some estimates much, much higher because a lot of childhood trauma is associated with shame, so people don't talk about it. In one survey of a large group of adolescents in residential treatment, 70% of them had history of trauma. One study of traumatized participants that had controlled for everything else found the following rates of dependence for alcohol, cocaine, heroin, and marijuana. So there's an extremely strong link between early trauma and addiction. So why is that? It has to do with a lot of the brain processes we've already talked about, this struggle to self-soothe, this deep sense of pain and lack of feeling of safety that folks just want to numb. I've definitely worked with folks over the years who said, you know, the minute that I had my first drink or my first hit, I knew that I was hooked because that was the very first time in my life that I felt okay, that I felt safe, that I wasn't afraid. Really powerful stuff. There are also some theories that this brain development that gets disrupted makes people more susceptible to addiction, more likely to have those chemicals kind of misfire, get hooked easily, sort of lack the brain capacity to understand I'm in a dangerous place, I need to make some different choices. Also a strong link between trauma and eating disorders. So again, these are some more statistics pulled from the research studies, significant predictors of eating psychopathology, emotional abuse, neglect, sexual abuse. In one study, 52% of folks with eating disorders also qualified for a diagnosis of PTSD. Much higher levels of purging in bulimics, which is a disorder where one eats large quantities of food very quickly and then removes them from the body either through vomiting or laxative use. A literature review, which took a whole bunch of eating disorder studies, found that 87% of them report that adverse life experiences, another word for trauma, are a risk factor for developing obesity and BED, which stands for binge eating disorder. So the reasons behind that, again, here we are at self-soothing. For some folks, the drug that they find most effective is food, and whether it's restricting and counting and obsessing over the scale and pounds gained and lost, or it's simply feeding oneself and trying to get those soothing chemicals going through food. That is what some folks find is the most effective in kind of soothing this trauma. There is also a desire to control one's body or something in one's environment when everything feels so out of control. This is especially true for folks who are survivors of physical and sexual trauma. Their relationship with their body is deeply, deeply affected. And this feeling like my body is not mine, I have no control over it. And regulating one's eating, overeating, undereating helps one feel a sense of control. So what do we do? Fortunately, lots of good treatments out there. Psychopharmacology, medications for mental health issues, very helpful in many ways. There are plenty of medications out there that can help with the symptoms, anxiety, depression, nightmares, panic attacks, those kinds of things. And while certainly they don't fix things, they can be a very nice tool for folks who are sort of using other treatments as a way to kind of regulate one's brain and one's emotions. Mind-body techniques, very powerful. Things like meditation, yoga, movement therapy like dance therapy or horseback riding can be very powerful in sort of accessing some different ways to self-soothe and self-regulate when one's brain is so dysregulated. Lots of powerful research, especially about meditation, in kind of healing the traumatized brain. So let's go. Other very promising therapies, cognitive behavioral therapy, which looks at this triangle between our thoughts and our actions and our feelings, and the interplay between them, and sort of helping us become more aware of how those work together and really harness that so that we feel more in control of our emotions and our thoughts and our actions that come after. Dialectical behavior therapy, which really focuses on a lot of things that folks who are traumatized have kind of missed out on: emotional regulation, distress tolerance, interpersonal effectiveness. This is another treatment mode that's been shown to be very powerful with traumatized folks. And finally, I don't want to leave out group therapy. It is incredibly powerful in a way that nothing else is, to find oneself with folks who have also experienced these painful things and to feel not alone and not isolated. Group therapy can certainly be hard for traumatized folks because a lot of this stuff is hard to talk about, but it is a powerful component when one has sort of gotten to the place where you feel ready to kind of share with others, to sort of feel supported and validated in that way. That's all I have for today. Please do contact me through email with the hospital if you have any questions. Thank you.